Hello, I'm Edouard Coupet Jr., and the title of our study is Emergency Department Patients with Untreated Opioid Use Disorder in 4 cities, a comparison of those seeking versus those not seeking addiction treatment. Before I begin, my only disclosures are that Dr. Kristen Huntley's spouse is eligible for a defined benefit plan through Pfizer from previous employment. This work was supported by NIDA as a part of the Clinical Trials Network CTN69, and my research was supported by K-12 from NIDA. Few studies have described characteristics of ED patients with untreated opioid use disorder. And this is important for informing future screening and implementation efforts and identifying ED patients with untreated opioid use disorder and initiating treatment. This is particularly important because many individuals present to the ED not seeking addiction treatment. And these individuals may require a different approach than those seeking treatment. The aim of this study was to describe and compare the social demographic and clinical correlates of patients with untreated opioid use disorder seeking and not seeking addiction treatment on presentation to one of 4 urban academic EDs. Our study hails from a larger parent study, CTN69, which was a NIDA-sponsored hybrid type 3 effectiveness implementation study of ED-initiated buprenorphine. This particular study was a cross-sectional analysis of ED patients with untreated opioid use disorder enrolled during the baseline evaluation period of the larger parent study, CTN69. Our ED study site locations were in Seattle, Washington, Cincinnati, Ohio, New York City, New York, and Baltimore, Maryland. We computed summary statistics for demographic information, education, employment, housing status, health insurance status, substance use by urine toxicology testing, and reason for ED visit. Within reason for ED visit, RAs asked participants, did you come to the ED today primarily to receive treatment or referral for your opioid use? And from here on out, participants who came to the ED seeking addiction treatment, I will refer to as seeking treatment. And participants who did not come to the ED seeking addiction treatment, I will refer to as not seeking treatment. We also categorized their ED presentation using their ICD-10 diagnosis code by opioid withdrawal, injection-related infection, other substance use, opioid overdose, and opioid use disorder. We further performed chi-square and t-tests to compare characteristics by their addiction treatment seeking status. In our study, 15% were identified as seeking treatment, whereas the vast majority of patients, or 85%, were not seeking treatment. We did not find any differences between the 2 groups in gender. We did find that when comparing whites to non-whites, whites were more likely to present to the ED not seeking treatment. We also did not find any differences between the 2 groups in mean age. We didn't find any differences between the 2 groups in their education status, employment, as well as their housing status. We also did not find any differences in between the 2 groups in their health insurance status. When looking at their ED presentation based off their ICD-10 diagnosis code, we found that those were categorized as presenting an opioid withdrawal were more likely to present as seeking treatment. Those with injection-related infections were more likely to present as not seeking treatment. Those with categorized as having other substance use were more likely to present as seeking treatment. And those categorized as an opioid overdose were more likely to present as not seeking addiction treatment. Lastly, those with opioid use disorder were more likely to present as seeking treatment. When looking at urine toxicology testing, we found that those testing positive for fentanyl were more likely to present as seeking treatment. Those testing positive for cocaine were also more likely to present as seeking treatment. Those testing positive for both methamphetamines and amphetamines were more likely to present as not seeking treatment. And those testing positive for opioids with a threshold of 300 nanograms were more likely to present as seeking treatment. So in conclusion, most individuals with untreated opioid use disorder seen in the ED are not seeking addiction treatment. And this is important because it really suggests that there's a need for more active efforts to identify opioid use disorder in the ED. We also determined that individuals in the ED with untreated opioid use disorder are challenged by multiple social risks, including racial ethnic disparities, housing instability, and unemployment. Some of the characteristics of ED patients less likely to be seeking treatment were that they were white, had an injection-related infection, opioid overdose, and opioid use disorder. They also were more likely to test positive for amphetamines. Thank you all for listening. And here is my email address. Please feel free to email me if you have any questions. Take care.